Good evening, everybody. Welcome on in to another installment of Medical Talk in Layman's Terms with Nurse Charlene. And tonight's topic is something that the fans or the people that come on faithfully and join in usually they give me ideas on what to talk about. And so I heard several different people talking about joints and ligaments and like nerve pain and all of that stuff. So I did a joints and ligament topic before and stuff, but this time I'm going to kind of concentrate on the nerve and joint pain, and then I'm going to give you a little bit of anatomy. That means telling you what it is: the hip bone connected to the blah blah bone, and so on and so forth. So you'll understand as I go along and everything. I have a really good board. I drew my heart out and everything and stuff, but it should be helpful and stuff. Maybe after or when you watch the replay, you might want to take some pictures of it and stuff, but I'll be explaining some of it to you and everything and giving you just a little something, a snippet of what's going on and everything. A lot of these names that I bring up and stuff, you've seen them before, and you've heard, like Stephen Curry with his Achilles tendon, going bad on him and different things like that, and different people and stuff. And so that's what I'm gonna be talking about. It's gonna be really good. Sorry, I'm putting somebody on and everything, but yes, and stuff. So that's where I'm gonna get started and everything. And y'all come on in. I still like to be hyped up and everything. So come on in, come on in, come on in and stuff. The topic tonight again is nerve and joint pain, but I'm gonna go a little bit further to just give you enough nuggets that you'll take something home with this, that you're not getting on here in vain and everything. And so before I get started with anything, I have to go ahead and read my podcast disclaimer. But guess what else? Tonight is special. It's a hallmark for me because it's marks my 1 year anniversary of doing medical talk in layman's terms with Nurse Charlene. And it's very special to me because last year, March 4th, though, of last year and stuff, was the day that I launched and everything. And I was just full of nerves. I still get a little nervous and stuff, but nowhere near that and stuff. It's definitely become more polished work and everything. But yes, definitely it's a big deal and stuff. So once I start talking about that, I'm going to bring up a little bit more on the subject of me, it being my anniversary. Today is my anniversary. And I just celebrated a birthday, but I'm the leap year. That's why I gave you last week. I gave you leap year to let you know what I am. But also, yes, I'm a unicorn and everything else. Make believe, I don't know. But anyway, I'm saying all of that to say that a lot of good stuff has been happening and everything for us. And this is a big deal. So let me go ahead and read my podcast disclaimer. Y'all come on in and mosey on in, scroll on in and stuff to me. Those on Facebook that are, you don't even have to be my friend to be on Facebook because I put it public, but I'm on there as Charlene Nurse Allen. And so you'll be able to come on and catch my podcast that way. Also, I'm streaming live from simultaneously with YouTube. And on YouTube, it's called Medical Talk in Layman's Terms with Nurse Charlene. And you'll be able to find me, but also you'll be able to find my whole channel where all this time, a year in advance, that I've already been on here doing my podcast every Tuesday at 7 p.m. Pacific Standard Time. Okay, so let's get on in. I'm going to read my podcast disclaimer. Thank you, guys. So it goes as follows. The podcast is for informational and educational purposes only. It is not intended to replace professional medical advice, diagnosis, or treatment. Always consult with your physician for any medical concerns. Okay. If you have questions about a medical condition, reach out to a qualified healthcare professional, your doctor. Never disregard professional medical advice or delay seeking it because of something you heard on a podcast, any podcast. I don't care. Oh, it's Dr. CB. Do you know him? Yeah, exactly. Do you know me? Okay. And if you don't, it's okay. But look me up, fact check me. Okay. And then guest views are their own and may not reflect the views of the host, which is me, or this podcast. The information shared is for general knowledge. Okay, just giving you a little piece to get you out the front door and everything. It should not be used for any legal or medical purposes. Okay. Always consult with a licensed professional who knows your medical history for a meaningful and good evaluation. So they're not nosy doctors. I keep on saying it, but I'm gonna say it again and stuff. Doctors are not nosy. They need to know your history. They need to know that grandpa or grandma had diabetes. They need to know that somebody died of a heart attack. They need to know if somebody had cancer in your family. They need to know this. They're not being nosy. They don't get to turn you into the government or something like that and stuff. If anything, they will get in trouble and get their license revoked. But they're not being nosy. This stuff is real and stuff. So with that being said, give it to them so that they can treat you right and treat you better. The people that give the most information, the doctor is more concerned about them because they know that they got to step up. If you know this much, I gotta do my part, or she might get me, or something like that, or he might get me, and stuff. So that's why it's a good thing to put that out there and everything. But always stay informed and always seek professional advice when it comes to your health, like an actual professional. And I am one, but I can't be everybody's nurse and stuff. But I can give you definitely advice, even with the topics that we're facing right now, because it just makes sense and everything. So I always start off with definitions, so that I don't lose anybody, and stuff. And they're, oh, she's talking all this stuff. No, I'm gonna keep it nice and cleaned up and simplified so that everybody, even somebody that don't have this big old education and stuff, you still get what you need out of it too. Because guess what? No matter how dumb or uneducated you are or whatever, you still got a human body just like somebody else. And half the time, if it's the dumb one or whatever, it's probably healthier than the people that know everything. Okay. And stuff. So welcome on in, you guys, and stuff. Hype me up. Y'all better come on here and stuff and get on this podcast and talk to me and stuff and tell me a few things. So I'm just going to start off with an intro. And it goes as follows. Pain is one of the body's loudest warning systems, the loudest snitch. Okay. Nerve pain and joint pain feel different. They behave differently and send different SOS, meaning save us, and stuff, signals. When pain is ignored, the body finds stronger ways to get your attention, like making you fall over and grab your knee, grab your ankle, grab your break something, and stuff. But it's gonna let you know. So you can ignore it. You can even give it Motrin and all of that, but after a while, nothing is gonna help. Nothing is gonna fix the problem. Nothing will be able to get you to the other side. So it's really important that you know this and that you pay attention to your body and everything. So then pain is not the problem, it's the message. Ain't that powerful? Pain is not the problem, it's the message. It's trying to tell you something. It's trying to give you a message that something is wrong here. But you didn't listen to the other things. So now it's gonna give you some pain and inflict some pain and stuff. Now you gotta pay attention. You want to get out of pain, right? So you got to pay attention. So that's where this comes in at and everything. So then what is nerve pain? So it's also called neuropathic pain, which means disease, and neuro is nerves and it's pain. So nerve disease pain, and everything. So nerve pain happens when nerves are damaged, irritated, or compressed. That means they're locked in there like a straw kinking off or something like that. And they get in there, like, especially in your spine or something, you can't move or something can paralyze you even and stuff. So it's really important that, you know the different types of pain, and it's caused from damage. irritation and compressed nerves. That means they bent off, they're kinked off, so they can't send that signal to make you walk back and forth or do whatever you got to do, or move your hands or move your wrist and all of that stuff. You can't do anything like that if it's pinched off and everything. So I'm gonna tell you, we're gonna go into common illnesses where nerves is really a big deal. I was gonna say prevalent, but a big deal and everything. And so we'll go to what it feels like. So instead of sending normal messages, nerves send false danger signals, and it feels like these things: burning. That's a symptom. That's a snitch. It's burning. Oh, you cool? You put some ice on it. You healed it right with the ice. Tingling. That's little they call it pins and needles, like poking yourself and stuff. It got this little funny, like if you hit your funny bone and stuff, and that little funny tingling and stuff, but it keeps on doing it and it don't stop. It ain't nothing you can do, but maybe punch your leg or punch your arm or something, but it's not getting to the good part. And then there's electric shocks. It'll send a, like almost like you've been electrocuted or something. It'll tase you. Oh, you still not listening? Okay. Then, like I said, the pins and needles and stuff, that was a big deal. And then they might even send a shooting pain. That means it'll shoot from one area all the way down that arm. The shot starts in the arm, you ready to grab that, but it hits you in your elbow and then all the way down to your wrist, or, in your hip, and it'll shoot it on down to your knee and then on down to your ankle. So it's a big deal and everything. So then, example is your foot burns even though nothing is touching it. That's that sensitivity. And they said one of the main things or main symptoms is burning and everything. So that's where that comes in at and stuff. So then what is joint pain? So that's a difference. I said nerve pain first. Now I'm talking about joints, right? So what is joint pain? Joint pain comes from inflammation, which is being on fire, hot, inflammation, wear and tear on, like athletes constantly getting injured and stuff. You wonder why, dang, Steph on the bench, and so had to be sit out, and it's going to take them a minute. They're going to miss a few games and all of that. They're not missing them because they want to. They want their check, and stuff. But if they can't even stand up straight, and stuff, because somebody then rip something or they didn't rip something trying to go hard in the paint and stuff, yeah, it's a problem and everything. So the wear and tear injuries or autoimmune attack on joints where the bones meet and everything. So it's trying to tell before I could tell you what's really going on. But anyway, that's where the joint pain is, because joint I wonder if I should tell you that yet. I'll say this part. So joint pain feels like stiffness, aching. Stiffness is when you go to stretch it out, or you trying to get up and it's ooh, and then you stand up, and then it take a little bit before you can start moving again and everything and stuff. But you was sitting down, you was calm, you was watching TV or something like that, and then you go to hop up, and that one leg or that one hip part or that knee, and you got to get up, and so that's where that comes from and everything. And what else? Swelling. Don't sleep on swelling. Swelling is just as bad as inflammation. It being on fire, then it starts to swell. That means it's getting bigger than the regular size, and it looked like it might be 1 to 2 times bigger or more, but at least 1 to 2 times bigger and stuff. So you'll see that. Reduced movement. You can't even really, you don't even want to stand up because it hurts so bad. So you start coddling it in that bent position or that straight out position and stuff. So then it doesn't even want to bend, or it doesn't even want to extend and stretch out, and stuff, because it's in pain. And then you're kind of like holding it there because you don't want to move it, or you're going to feel that intense pain and everything. So then there's pain with motion and pressure. That means that you're walking, but you every little step is like, oh my God, and stuff. It just it's killing me. It's killing me, and stuff. And that's where that comes in at. And then what else? An example of joint pain, the knee ache and crack when standing up. So it doesn't just ache and it's already sore and stuff, but it actually crackles and crunches in there. And you like, what is that doing? And stuff. That's where the pain, it's hitting it. It sent you some warning signs. Now it's breaking down. So now it's like, come on, and stuff like that. So that's an example of joint pain. So some of the most common nerve pain disorders and stuff, and they go as follow. One is a peripheral neuropathy. I get tongue tied a lot and stuff, but I be trying to pronounce them and stuff. But peripheral neuropathy, and a definition of that is damage to nerves outside of the brain and spinal cord. Meaning peripheral is your arms, your extremities and stuff, which is your arms and your legs and stuff. It's a distance away from your actual spinal cord and brain, business and everything. And so let me see, what else did I want to say on that one? Some of the common causes. Diabetes is number one. Diabetes. Also alcohol use. No, I'm not hating on alcohol. I'm just telling you the facts and everything and stuff. Vitamin B12 deficiency. That's another one. And then there's also chemotherapy. These are all reasons for, this pain. And then also there's infections. They cause a lot of trouble and pain and different things like that and stuff. So that's a big deal and everything. So an example of these things, the neuropathy happening to you is that an example is numbness, that burning in the feet at nighttime and nothing is really touching them. That's the problem, and everything. So those are some examples and everything. Another one, so that was peripheral neuropathy. The next one is sciatica. Does anybody know what that really is? So it's a thing called sciatica, or it's a illness, and stuff that a lot of people are diagnosed with, even more so. And the sciatica, I'm about to explain it. It's the compression of the sciatic nerve. That's where it gets sciatic cuff from, is the compression. That means I told you it kink off, so then it can't send the right signals and everything. And so this is where that nerve runs through. It runs from the lower back down the leg, the back of the leg most likely and stuff, all the way down to your feet. This is the cold part. It runs through your booty. So that's why you be feeling the butt pain, that butt cheek, wherever that sciatic nerve is pinched off at, it hits that butt cheek too and stuff, and it'll tear you up and stuff. It's very painful and everything and stuff, but that's what happens. Also, what else? Some causes of the reason why you get sciatic pain or sciatica is a herniated disc. That means one of the discs in your spine, it has a bulge on it and stuff, which is not supposed to be there. It's supposed to be even, in between there. So, in between each bone, it's supposed to, they're supposed to sit on a cushion. When that cushion has a hernia, that means it's been compressed on one side. So it balloons out where it's not supposed to. It's supposed to evenly wiggle as you go and stuff like that. But this thing is popping out like a smashing down a balloon, and wherever it has the most room, it bulges out right there and stuff. So that's the problem. It's painful and stuff. Also, this thing called spinal stenosis, which is the stiffness of your spine and everything and stuff. And that's a real thing. And then there's also from prolonged sitting. Like if you're sitting when you go to work and stuff, and you're at a computer or some IT, something like that, and you're sitting for all those hours. Then you come home and you sit, and maybe sit and scroll, and stuff like that. That's where that comes from. And then what else? Examples is sharp pain shooting down one leg. Remember, through the butt, because it starts at your lower back. So your lower back, then your booty, and then your leg, and stuff. So it shoots down that one leg and stuff, and it causes chaos until it's done being inflamed and mad and angry and stuff. So that's a big deal. So then it's number three is it's called carpal tunnel syndrome. And the definition of that is compression of the median nerves in the wrist, or what I had on this hand and stuff. They had to do carpal tunnel surgery probably about 20 years ago and stuff now and stuff. But my hands, every time I would pick up somewhere, if I bent my wrist down so far and stuff like that, and I'm trying to do something or bend and do something, because I always been busy and up to stuff. So I'm bending down like this, and it's bent over like this, and then next I'm like this, and I'm like, look at my hand, and nobody understood why my hand is doing what it do, and stuff, or it curl up and stuff. And I was like, y'all see that, y'all? And they like, that's so stupid and stuff. And so my supervisor way back in the days was like, do your hand like this. And I said, and she said, okay, what's wrong with it? I said, it's in the inside. It's something. It feel like strings were being pulled. And so my hand is like this, and I reach in there, and if I pull them, my hand curl up, and stuff like that. And that's the only way I could explain it. But it was nerves in my carpal, which means hand, and a tunnel that connects your hand to your wrist, your hand bone to your wrist bone and stuff. That little area, it's a little tunnel that all the nerves run through and stuff. And when they run through that and it gets compressed, or it starts growing a lot of friction through it, it's harder for it to adjust. And that's where you get that pain and stuff. And it's a cold-blooded pain. And usually, depending on the severity and stuff, they could give you physical therapy, but most likely you would have to have surgery. And they have to peel it back and scrape it down some, and then sew your hand back up and stuff. And then you get it back after some time in a physical therapy and getting all these treatments and stuff. It'll, kind of start healing and stuff. That's what it needs to do, heal and stuff. So how you get it, carpal tunnel syndrome, the typer's hand, you on the keyboard all the time, blah, 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 it don't matter how fast or slow you, even a pecker can get it, and stuff, but that's where it kind of comes from. So it's also repetitive hand motion, always doing something, picking this up, doing this, doing that, doing it, and stuff, and you're moving and moving, move all day long as you're awake and stuff. And so it's a problem and everything. Also, what else did I want to say? Poor wrist posture. So remember, I said a keyboard. So if that's why they had those little pillows that you could put at the bottom where the space bar go, so that you keep your hands a certain way and they don't get all that treatment. And this is me. But some other type of, and stuff, they can do that and stuff. You still can get carpal tunnel, whether you fast or slow like me. But anyway, also there's swelling, and usually this is from pregnancy or arthritis and stuff, which is inflammation of the joint and stuff, because arthro is joint and itis is inflammation. So a burning joint, and everything. And also pregnancy and stuff. That's where the swelling comes in at, but also some of the causes of getting certain pains, in your body. Then you got, do I want to do this one? Okay, I'll do this one because it makes sense too. It's one called trigeminal neuralgia and stuff. So yes, I'm not going to go through all of that and stuff. If you haven't heard of it, you wouldn't know what it is anyway and stuff, but I'm going to give you the definition. And that is a facial nerve. So, you got nerves to make you smile, to make you mad, to make you, all of that stuff, to make you sad, angry, stuff. You do all of that. Like you see my eyebrows, those are all nerves in our body. And if they're not working right and stuff, because say there's dental problems and stuff like that. And, when they're pulling teeth, they have to get you to sign that little consent, because if they damage your nerves and stuff, and your jaw just hang open for the rest of your life and stuff, they don't want to be responsible for it. you went in my mouth, so you is responsible. But I'm just saying, and stuff like that. You got muscles all over that do everything and smile and all of that stuff. That's where that comes from. I know that sounds crazy, but that's what it is. So it's facial nerves causing the pain or severe facial shocks, and stuff, different things. Welcome on in, Auntie Josie and stuff. I appreciate you. I know you're going through some things and stuff, but we're gonna talk about it after the live and stuff. But I hope you got my text and stuff. But thank you and stuff. So why is it not showing on the actual? I'm wondering. Okay, it's not showing me any comments or anything and stuff. It's okay and stuff. So hand numbness while driving or sleeping is a good example of what is it called? Carpal tunnel syndrome. Yeah, carpal tunnel. Carpal meaning your hand. The tunnel is what the nerves go through. That tunnel is connected to your wrist bone and your hand bone, and they're connected together. And then they have all these nerves running through them, and that's why you can do this or do this or do that or wave and all of that stuff. And when you have a problem like carpal tunnel, you do this or this or I can't unfold my fingers, and stuff like that. It's a real thing. And I had it, so I'm an expert at it. I had it and I had the surgery. So I know what it really is and stuff. So then going back to trigeminal neuralgia, one of the examples is it's triggered by brushing your teeth or talking. So I can't talk. I can't brush my teeth. Well, that's probably gonna be a problem if I can't brush my teeth and I can't talk. What is my mouth here for? Well, I can eat and stuff, but it's the talking, because you got to use your lips and stuff. And oh, I don't like that, and and stuff like that. That's where that comes from and stuff. I know it's weird, but yeah, that's what it does. And so, some most common joint pain disorders, because we're doing nerves and joint pains. So now we move from nerves into joint pain. And one of the number one things that you can get is this thing called osteoarthritis. Oh, that's a big word. There she go. No, because I'm gonna break down osteoarthritis. Osteo means bone. Arthri is the joint, so bone, joint, and itis means inflammation. So your bone, the bones, at your joint, they're inflamed. So that's all that means and stuff. So it's osteoarthritis. And the definition is it's a breakdown of your cartilage in your joints over time. This is over time. So remember how old you are, now and stuff like that. And you'll notice this more on people above 50, unless been, like a basketball player, football player, soccer player and stuff, then you might get it earlier from repetitive injury after injury after injury and stuff. So it gets real rough to you and everything and stuff. And so it's the breakdown of course, cartilage over time, and it's common in the knees, the hips, the hands, and the spine. You mean to tell me? Okay, but yes. So remember, each of these places have a joint connected to them and everything. So examples of it is stiff joints. That's your elbows. You can have, a pain in those elbows and stuff, which are joints. The you got a top bone that go from your shoulder to your elbow, and then you got a bottom bone that meets that other bone and goes from your elbow down to your wrist. You see how that makes sense and everything and stuff. So the ending is I need to do this before I finish and stuff. But that's what it is. Stiffness in the joints in the morning that improve with some movement. So you got to get them warmed up like you warm up a car or an old car and stuff. You got to warm it up before you can just take off on it, or it be hissing or something like that and stuff. So before I go any further, because it seemed like I keep running into this, so I'm gonna go ahead and just a quick sidebar. A tendon. So we got a tendon up here. And so what I got is a tendon. What it does is it attaches muscle to bone. That's what a tendon is. It's a band, elastic type band that's a little bit stiffer because it got to do a lot of work and everything and stuff, and it got to have some give to bend your knee and actually bend your elbow, move your shoulder up and down, and bring it all the way up and down and stuff and all of this stuff. So it's a big deal, and so that's the tendon. And another thing that you might have heard of, I'm not sure, but if you've ever heard of Achilles tendon, that means it connects the calf muscle. So your calf is that one right below your knee and stuff. That's that little muscle. But usually your calf, sometimes a lot of people's are not muscular, but if you bike or work out and stuff, you usually like to work them calves out and stuff, which puts a nice pretty muscle on you and stuff, and you got that little defined area and stuff like that. So the Achilles tendon is the one behind your ankle. And what the tendon does there is the Achilles tendon, it connects the calf muscle to the heel bone so that you can walk and run. It's very important. And if you watch any type of sport, you'll hear this all the time. It's always some damage to those things and stuff because they're working it and doing plays over and over and over and over and over. And it starts hurting really bad and stuff. But also, don't worry about the hurt before you worry about how did it start and why does it hurt every time I do this or that, because it's responsible for your walking and running. If you don't have nobody is without an Achilles tendon unless they don't even have a leg at all, and stuff. It might have been amputated and stuff, but that is for running and walking and stuff. So that's a big deal. A ligament. This one you might not be able to see because I see it's real bright and stuff, but it's called the ligament. And a big deal is, I don't want to say the other name for it and stuff, but a lot of people talk about the torn ACL and stuff. And the torn ACL is the ligament that connects bone to bone in your knee. So if that bad boy pops or breaks, oh my God, and stuff, first of all, they got to sew it back together. Then you got to stay off of it for a long time and stuff and let it heal back together, mesh itself back together. Then you got to go to rehab and start working on it and moving it around, or you'll lose it all together and never be able to walk. It'll cripple you and stuff. So that ACL stabilizes the knee joint and everything. So that's a big deal. And then joints. They're also called your ball and socket because I got it right here above my head. It could be where two or more bones connect, and it's the thing right in the middle right there and stuff, and that's your joint space. And these bones come together with your ligaments and tendons to make sure they stabilize so that you can do something simple as this, so that you can do something as simple as this, so that you can move your legs back and forth and everything. So that's what it's responsible for. And so I just wanted to make sure that I gave you a little sidebar on that because that makes sense. Welcome on in, sweetie. My cousin Tony. She said, hey, family, it's Tony. I'm here. Thank you, cousin, for coming on in. We're talking about nerve and joint pain. And if you missed some of it, no worries. I'm still in the good part and everything. I'm right in the middle of it and everything. You could go back and watch the replay after it's over. But I would have loved to, sing you before then. But you come in and stuff. I'm thankful. Thank you for your time. Yes. And so what did I want to say? The wear and tear of osteoarthritis is common in your knees, your hips, your hands, and your spine. And the stiff joints in the morning that improve with movement. And then you got rheumatoid arthritis. It's one of my, I just did autoimmune diseases, and it's one of them and stuff. It's really a thing, and it's crazy and stuff. Thank you, Tony. She said, it's all good. All right. And stuff. But I want you to know about this too, because I know we all, in our 50 somethings, I'm minus 50, but other people, and stuff that's in a 50 something and stuff, they, you start getting real stiff around that time. But it doesn't matter. It's male or female. Male being uh, yes, she said, "Wow, cuz you talking about me tonight and stuff." Yes, in the fact that you know, we all that stiffness and we hop up, you know, after sitting down, we playing dominoes or something like that. We sit down and stuff, and we chilling, you know, and stuff. Then you, oh, I got to go to the bathroom, so you go to hop up, and you almost fall on the ground because that pain hit so hard in that hip or that, you know, or that knee or something like that. And you sit up there like, oh. Or I know Tony know about that. We had after the barbecue at my mother's birthday party, maybe not last year, but the year before last, we were skipping and everything. Okay. Welcome on in, Miss Sandra and stuff. Thank you for coming on and stuff. Tony said, um, got a hip replacement scheduled for March 30th. Oh, we gotta talk. We gotta talk. And then there might be one other person on here. I'll check and see and stuff. If they want to talk about it and stuff, you know, you could go ahead and put it in the comments and stuff about these surgeries, you know. Hello, family. Sorry, I've been absent. No, it's okay because you always make sure that you're thoughtful and send me, you know, some type of text and stuff, a good morning text, and that just makes my day each morning and stuff. So I do appreciate you. You're not absent from nothing. You got to take care of your business and everything and stuff. So you got to do what you got to do. But I appreciate you for coming on, and I appreciate your time. And Tony said, yeah, I remember the skipping contest. We all was trying to figure out why we can't skip anymore. I was like, even the little kids couldn't figure it out, but we used to skip our little life away, you know, and stuff. We skipped down the street, up the street, have races and stuff like that. And then we tried to do it this time, and nobody's coordination was exactly on point. we was all messed up. Thank you too, Sandra and stuff. We was all jacked up trying to skip. Yeah, and I still got it on film, Tony. And stuff. So moving on to this rheumatoid arthritis. The definition is the immune system attacks the joint's lining, the lining of the joint. So that means that's that cushion area, that protective lining that lines everything and keeps everything in place, and it keeps all the juices where they're supposed to be to balance you when you're standing upright or walking, just simple walking and everything. And it's a big deal. And some symptoms that's a problem is you'll see swelling. So anybody that's had this problem, you already know what I'm talking about. So swelling is number one. So it ain't nothing new. Like, oh my God, look what mine did. No, everybody does that when the wear and tear is just too much for it. That's what it does and stuff. So definitely swelling or warm joints. It's warm to the touch. It's cooking up in there like a little heating pad and stuff. But I haven't put nothing on it. That's why they try to tell you to put some ice on it and ice it down and stuff. But that ain't gonna help. I don't know if you've ever seen the basketball players there on the side of the bench, and somebody will take an ace bandage and about 5 ice packs and put it on there and freeze it up so that they can get their tails back out there. We'll worry about it after the game and stuff, but for right now, let's ice it so that they can come back in the next quarter in 5 or 10 minutes or something like that and stuff. That's where that comes from. And then I told you the symmetrical pain. That means it's the same pain on each side. So both hands, both knees, both hips and everything. And that's where that comes from. Because usually when, and it's not to try to give you bad news, but to watch out for it and stuff. If you've had knee surgery or, you know, had it or about to get it and stuff, there's most likely it's both legs. Because what happens is you start compensating by staying off that leg because it hurt. And then the other will start hurting because you put all the pressure on that one. You trying to work a little bit easier on this side of your hip, you know, because it's on the right side and that's where it started. Then the other hip try to give out because it's like, I'm jealous. I want a surgery too. I want a BBL. No, I'm just playing. But anyway, you know, it'd be like, I want one too. So just watch that because that might be a thing where one will start getting better. And then now you stuck with the other one. and stuff. So if you got two hips, it's getting down. And then, oh, thank you, Rosie Granny Allen came on. I love you. She said, Rosie Granny Allen is watching in Jesus' name. Amen. Teach, nurse, teach. I sure will. Thank you, Mom, and stuff. So, the example is hand swollen and painful in the morning. That's arthritis. That's actual arthritis, and it's usually in your sockets of your, you got different joints and your fingers and stuff that bend them all the way. You got to join 1, 2, 3, and stuff. So you see where I'm going with that and stuff. 1, 2, 3, and all of that and stuff. So it's different ones for different things. And this is just my fingers. So what about what about other parts of my body? Yes. Your spine got all these your rib cage and all these little discs and vertebrae in the back and stuff like that. So all of this stuff is crazy and stuff, but that's what's happening. So Miss Sandra said, that is so true, but now I know what to expect when I have the other knee surgery. Yes, so one of our faithful clients of Medical Talk in Layman's Term with Nurse Charlene, Miss Sandra just had surgery, if that's okay, to give permission for it in her knee. So now, because both, they took out the worst of the knee problems and stuff, but remember, it comes in twos. If you got two knees, it's trying to hit both of them. Like, one might get jealous of the other. I don't know what they doing and stuff, but whatever happens, that's what, usually takes place. So when I had my carpal tunnel surgery, which I really did have carpal tunnel, and they shaved it down, it felt good after it healed. And then the other one started acting up. I was like, no, we don't get to do that. Don't be jealous of that one, and stuff. Like, I didn't even like that one that acted up, but it acted up, so I got some work done on it. And so now you can't be acting up. You don't get permission to act up, but it can. They the same, and stuff. Because guess what? This is my writing hand. So I had to learn how to write with my left hand because I had surgery on the right and stuff. So then I'm putting all the pressure on the left hand now. And so you see what it's doing, and stuff. So you put, when it's one side is worse, then the other side, watch it. At least make sure they watch it. When you do an x-ray or when you do your MRI, you tell them, get both my hips so we'll know which one is going to act up first or something like that, because that's a problem. And what if they're both so bad that you barely standing on this one and getting your rehab on this one, and this one is already acting up, so you can't even stand, or something like that. And so it's that troublesome. And then Rosie Granny Allen, she's there, my. Yeah, because arthritis is cold and stuff. And then I want to talk about a big one that nobody really mentions, gout. Gouty arthritis. That's what it really is. It's gouty arthritis. And the definition is a crystal buildup from high uric acid levels. And we're not going to go all the way into that because I would have to do the anatomy and physiology. Just know that it's a buildup. It crystallizes up your uric acid in your body and stuff. And Sandra said, that's fine. This is the best podcast ever. Your body is a snitch. Yeah, be telling on you. Because even if you didn't think so at first and stuff, I told you it's the national anthem of Medical Talk in Layman's Terms with Nurse Charlene, is that your body literally is a snitch, and it'll tell. And a snitch, is, I said snitch, but a snitch is just a symptom. And how do you go? When you got a cold, it gives you symptoms. You get a fever, you might get a cough, you get a snotty nose, or a stopped up nose, and nothing will come out and stuff like that. You might get a sore throat. Snitch, 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 snitch. Symptom. So if you catch that and stuff, then that's it. Thank you, Miss Sandra and stuff. So then what else we got? The arthritis and stuff. Examples of sudden severe big toe pain. That means it'll attack your big toe. I mean, it's supposed to be a big toe, but leave my toe alone. But that bad boy be burning up in there, and it'll swell up like a ballpark frank and stuff like that. And it just burn and burn and burn. I don't know if I've ever had that, but I stumped my toe and it felt like it was some gout or something and stuff. It swelled up too. A whole speaker dropped on it. And I want to beat the hell out of that speaker. I hit adamant objects as a part of my therapy, mental health therapy. I will hit the door if it run into me and hit me in the forehead. Like, what you do that for? You know, and stuff. So I got my problems, but I'm on here teaching too. So y'all don't do what I do, and that's hit inanimate objects. I'm walking outside and the sidewalk is uneven or something like that. And I almost trip and fall. I'm gonna look back at that sidewalk like, why you do that? You know, and stuff. You know, yeah, that's the problem. And stuff. Rosie Granny Allen said, "Body is telling on you. Well, help us, Lord. It sure tell on us. I ain't gonna even lie. It's been telling since the day you was born and beyond." Probably before you was even conceived good and stuff, it was already telling and everything. So then there's another one that's called bursitis. So burst is your what is those, the fluid filled sacs, and that, remember I told you you got to have cushion in between, like your knee to the knee and all of that type of stuff, and that cushion is called bursa and stuff. It's a little fluid filled pocket or little bag that sits between joints and stuff to give them a little cushion. Is I don't know if anybody's ever heard of shock blocking. That's where that comes in at. And yes, Tony, she said, yes, that pain ain't no joke. It's cold. It's cold. I'm not gonna lie and stuff. It's crazy and stuff. But yes, definitely that. And this is bursitis, and it's an inflammation of that fluid-filled sac cushioning the joints. So it's between all the joints. So your elbow got, a bursa, different parts. Your knee has it. Your ankles, everything has a little cushion to make it a little bit easier to walk. When that stuff start wearing off and stuff, you're basically in trouble. You're in trouble. And stuff, and that's on everybody, not just because I'm a nurse, I know everything. So I'm not. No, I get it too. I get hurt. I get inflammation. I get tendonitis. I get all these other things that I'm talking to you about, and I'm learning right along with you while I'm teaching you this, and everything. So yes, it's crazy. An example of bursitis is the shoulder pain when lifting the arm. I only can do it. I can't get. I can't get it up there, and I definitely can't. Ooh, that's just doing too much, and stuff. But that's where that comes in at. That pain is, it's a socket. Like I said, the joint is in between here. This is bone to bone, and that's your that one is your attaches the bone to bone, and then that over here is called a ligament. So this one is a ligament that's going across that's two bone endings. I didn't want to draw a whole skeleton and stuff, but that's two bones, and then what attaches them is called a ligament. And then this one down here, this is a tendon. It attaches muscle to the bone to allow movement, bending the knee, stretching the knee out, extension and flexion, where you bring it in, and stuff like that. That's where that comes from and everything. So if you look at it and stuff, you'll start seeing that it makes sense and stuff. It's crazy, but it does make sense. So then what else we got? The causes and risk factors. So nerve pain causes the reason why you have nerve pain, diabetes. That's number one, diabetes. And so that's why they always want to know your A1C. They want you to lose weight. They want you to always be exercising and all of that, because nerve pain, one of the number one causes of nerve pain is diabetes. And everybody that says that they're pre-diabetes, including me and stuff, at times I was diabetic and stuff, is because you're a step away from converting into diabetes. So you're kind of diabetical. That's what Brittany brought up. It's not really a word and stuff, but she said, Granny drinking a Coke and she diabetical, what you were telling on her. So that's where that word came from and stuff. But it just means that diabetes is the number one cause of nerve pain. Poor circulation. that means the blood is not circulating through everything and stuff. That's why you got problems with your blood vessels, your veins, and everything and stuff like that. They're not getting that good juice flow of blood, proper blood going back and forth and stuff, because your body needs this in order to function. That's why it's behind skin and layers of skin and everything and stuff, because it needs the blood in your body, and everything. Then you got injuries or surgery. These number one reasons to have nerve pain and stuff is because we have injuries which lead to sometimes surgeries. If you got a torn ACL or something like that and stuff, that's what happens to you and everything. With Mother Ouch said, help Lord, ouch, help Lord, you right, help and stuff. And then repetitive motion, like I told you. Some people be proud that you could do this and wave, I'm Miss America or Mr. America or whatever you want to do, or, and stuff like that. But just be proud you could do that, because a lot of people, after a while, it's all bad. Also, alcohol use. And I'm not one to discourage alcohol and stuff. I'm saying excessive use mainly and stuff will lead to this. And then also vitamin deficiencies like your potassium, magnesium, calcium, phosphorus. All of these things are stuff that the bones need, and stuff. And we're talking about, even though we're talking about nerve and joints, if you ain't got no bones, and stuff, that's a problem. Everybody better have some bones, in their body and stuff. But that's where that comes from. And then also infections. This is a big one. And shingles is one of the number one infections. If you've ever had chickenpox, it's the next step over, or the level up from chickenpox is shingles. And it usually hits you past 50 and over and stuff. If you ever had chickenpox in your childhood or something like that and stuff, then you're up for shingles. That's why they have shingle vaccines, they have chickenpox vaccines and all of that stuff. So it's a real thing, and it is nerves. It ain't just playing with your skin and it put a little chickenpox on me, or it put a little burning spot here and there and stuff. That it's no joke, and it's one of the most painful. Yes, cousin Tony said right. That's right and stuff. It's literally that bad and stuff. And then joint pain causes premature aging. You start looking older than dirt, and stuff. And you young still, and you wondering why that's happening and stuff, because that's one of the number one things, is aging. It also joint pain causes is obesity. So the aging causes the joint pain. That's where that arthritis, that arthro is killing me, it's tearing me up. But also being obese or over your body weight and stuff. They want everybody skinny. It's not happening, but slim down a little bit. If you this high, come down a little bit, but you don't have to just break yourself down to cracky size or nothing like that and stuff. I'm just saying and stuff, but it's a big deal and stuff. Also, autoimmune diseases cause the joint pain, like arthritis, inflammation of the joint. Arthro is joint, itis is inflammation. So inflammation of the joint area where your bones meet, and everything. So that part. Poor posture. Okay, but anyway, poor posture. I'm telling on myself, but okay, let's do it and everything. Also, injury and overuse. That's your athletes, male or female, boxer, basketball player, football player, soccer player, baseball player, all of them. You can get it. You can get it. You can get it. Okay. Genetics. So it running my family. Oh, that's jacked up. I got a jacked up family. Can I trade? But anyway, stuff that, and stuff. So even genetics is a problem. And then symptoms are what your body is saying. If it's snitching, it's saying something. It's trying to tell you something. And so for nerve pain, it's burning or stabbing pain. I said nerve pain is burning or stabbing pain, numbness, tingling, weakness, just absolute weakness. You'll know because you get the rubber legs or something like that and stuff. And then sensitivity to touch. It hurt to touch my own skin. You said what causes arthritis? Well, one is it's the joint. It's inflamed. So just your answer is right inside there, Miss Tony and stuff. It's arthro means joint. Itis means inflammation. So it's the inflammation of your joint and everything. Now you said what causes it. That's basically what does cause it, but it's another just sorry. The joint pain and stuff. I just had it too. The causes. It was early on, so everybody didn't catch it right away and stuff. So let me see. It's here. It's here. It's here. Just looking for arthritis, period. Okay. So that's the symptoms, but the cause. I just said it. Oh, joint pain causes. Okay. Here we go. I'm gonna say them off to you. So the causes of joint pain is your age. The older you get, the more joint pain you're gonna get. Obesity. That means the what did you say? Let me see. You said, yeah, because I have the pain to the touch on my foot and the burning. Okay, so it could mean a couple different things. Is the left side the one that you're going to have the surgery on at the end of the month? Let me know. And you said on the left foot because that can mean two different things and stuff. We hoping it's not it's arthritis, but also remember gout is arthritis too, and that's a uric acid buildup and stuff. So they do actually a blood test, and they can let you know what your levels are and stuff. And then you can even bring that up to me and stuff when you get your labs and stuff, and I'll go over that with you. And stuff. I mean, you my folks and stuff, so you already know the number and stuff. But yes, definitely that. Thank you for asking that and stuff. But that's one of the biggest ones. So they said what causes arthritis, period, is getting older, over your overweight, over your regular weight class and everything. Then it's an autoimmune disease. So it's a self-destructive disease, because it actually attacks the body because it sees it as a foreign body when it's just when it's your body just acting up at the time. And then there's injury or overuse. Always playing basketball, and then on them same legs that you played as a teenager, now you playing basketball and you bigger, much bigger, grown, fully grown and stuff like that. And then poor posture, and sometimes it runs in the genes. And you said the left hip. So that's why everything on that side is going to act a fool. So you got to pay attention and tell a doctor on all of it. Because it might not just, hit that one area like your hip and your foot and maybe your knee. It's going to try to hit everything on that side. So start watching out for your wrists, your elbows, your shoulders, and all of that stuff and everything, because it'll do that and stuff. It get jealous. If you paying attention to one part, you're not paying attention to the other, then it start acting a fool with you and stuff. But thank you. That was good work and stuff. So then let me see. Okay, so joint pain symptoms is usually swelling. It's gonna get 1, 2, 10 times bigger than it's supposed to. So you already know that's one. Stiffness. When you jump up, you can't just jump up anymore. You got to kind of shake it out a little bit, maybe massage it with your hand or something like that before you could get on down and stuff. Oh, yes. Antoinette said the eyes and stuff. Actually, yes. That's why you got to make sure you checking everything. Get the full tune-up, because it's not just staying there in the hip. Now it's out of its lane. So it's going buck wild, and everything. But you can rein it back in. So it's all of it's recoverable and stuff. Everybody, include Miss Sandra, it's all recoverable and stuff. And then also another thing, symptom is limited movement. You can't just jump up like you do. You got to shake it out and kind of lay there a minute and stuff before you could get up. Another big one, and you probably Tony, you might have seen this one and stuff, is clicking and grinding of that socket, and everything, and then warmth and redness. Welcome on in, Auntie Rena and stuff. Thank you for coming on and stuff. We're talking about nerve and joint pain and where it comes from and stuff. So on my board, I'll be writing all of this stuff, and it's bones and tendons and ligaments and all of that stuff. And that's where that's coming from. But welcome on in, my dear. No worries about the late, because you can watch the replay after. I just can't interact with you, afterwards, unless we on the phone together and stuff. But yes, and so I just gave the joint pain symptoms and why they are what they are and stuff. And then also, how do we diagnose this? How do the doctors figure it out? Well, one is they get a medical history. So remember, I said this at the for anybody that caught the beginning and stuff. I said the doctors are not nosy. You got to tell them what's wrong with you, and stuff, because they don't know what to do, and stuff. They need your medical history. With grandma and grandpa, it makes sense on each side, dad's side or mom's side and stuff. Grandma and grandpa, sister, brother, auntie, uncle, kids, whatever, cousins, and stuff like that. We all need to be paying attention and stuff. And you tell them, the more you tell them, the easier it is for them to figure out what they do, because everything is recoverable if you give them enough time to get it in there. So you got to tell them and stuff. So then physical exam, getting your exams, annual exam, annual is yearly exam. So a physical, I got to go get my physical for work. Well, even when you stop working, you probably should still get your physical. You still got the same body, and stuff. So whether you're working or not and stuff, let's go get that physical and stuff. That's one and stuff. And then also getting those blood tests. Now, I did the diagnostic last year on this, so maybe I'll revisit it and stuff and tell you about the blood tests that they usually try to get for you, the basic ones and stuff. But they'll tell them a lot about what's going on with you. And then another thing, I know everybody had one, by now and stuff, except for kids and stuff like that. That's x-rays and MRIs. And even the kids that fell and broke something. I was playing kickball with a basketball when I was little and had my hands all like, I got it. That smack and broke it. I was like, I quit. I hate y'all. I hate that ball too. It was the boy kicked it so high up in the air like he was Superman. And I was like, here it come. I got it. What if it would have smashed my face in? But it broke my wrist, literally. And I quit. I'm going home. I hate y'all, and stuff. It went on. I didn't understand it, and my wrist was broke and stuff. So the moral of the story is don't play kickball with a basketball. And if anybody kicks the ball that hard where it go up in the air, you better get away from it, because it's coming down, it's slamming down, it'll break your whole arm. And so Cousin Tony said, yes, cuz I have all the symptoms you're talking about. Stiff joints when I sit or stand for any period of time, stiffness be killing me daily. Exactly. And it'll just almost terrorize you and everything. So you doing the right thing, you told on it, because you already got surgery scheduled. So you actually had the nerve to tell on it. So guess what? You get a reprieve, because once they fix it, now all you have to do is, after all the pain and all the little weird stuff and physical therapy is over with, you good to go, at least on that side, and stuff. And so just make sure that you making sure they check both sides no matter what and everything. But yes, you good to go. So you just pretty much saved your life, or your quality of life, before you go out of here and stuff. At least you can have some good times, and everything. So thank you for telling me that and stuff. But yeah, that makes sense. I did x-rays and MRIs, and then it's a thing called nerve conduction studies. A lot of people I got diagnosed with it's called bilateral neuropathy in my feet and stuff. And what that means is bilateral is both of something, and stuff, knees or, hips or ankles, or whatever it is, mine or foot. But they told me it was this thing called plantar fasciitis. It was never plantar fasciitis. They was like, why you won't come down on, because it came suddenly after I caught COVID, and stuff. So I was wondering why I couldn't put my heels down all the way. It felt like a knife was gonna come up through them and stuff. And I was like, what is this? Like, so I just tiptoed around and stuff. But guess what? I wasn't telling everybody your body is a snitch, because I should have been found out. So I found out late, and I suffered a long time with that. And now I still have it. It doesn't go away, but now I control it instead of it controlling me and stuff. So that's the difference between me standing up and walking through all the stores and doing whatever I got to do and handling my business, or sitting up in a wheelchair somewhere because I can't put my feet down. I can't stand on my feet, and stuff. That's a problem and everything. So there's another thing called a EMG testing. It's just basically electromagnetic testing and stuff, where they test your nerves and everything, and check them out and stuff that way and stuff. That's how I was diagnosed with carpal tunnel and stuff, and had to have surgery on my hand and stuff. That was a big deal. And some of the things that they do as far as pain treatment for your nerve pain, they got medications like, has anybody ever heard of gabapentin? Yeah, don't take that unless you cuckoo for Cocoa Pops already and stuff, because I don't know what that is. But I told them I felt like I was falling, and I was laying in the bed like this, like I was inside a what is that, a ride at Great America or something like that and stuff. And I was like, yep, I'm not taking that. I knew my patience was a little special, and I couldn't figure it out and stuff, but they was on high doses. I was on one of the lowest doses they had, and that thing almost killed me off and stuff. So the moral of the story is, tell them to search around for another one. If one don't work, move on to the next one. And so be like, I know you got other choices out there. Give me one of the rich people choices or something like that. Don't just give me this other little low bottom of the barrel and stuff, because sometimes that bottom of the barrel causes more symptoms, more snitching and everything. So they got that, and they got antidepressants. I guess the antidepressants work on your brain and chemicals in your brain and stuff to keep you from being sad or suicidal, but also it works on chemicals in your brain for that pain and that numbness and tingling and all of that stuff, because it's a nerve thing and stuff. So I guess they're interchangeable. Also, controlling your blood sugar. Didn't I say diabetes? That's a big deal. And then there's physical therapy. You ain't even doing nothing and stuff. Why I gotta ride this bike? It ain't going nowhere, and all of that. Yeah, but it'll work for you, and stuff. Give it a chance and stuff. Even me, I had to go to physical therapy and all of that stuff. So yeah, you gotta get on in there and stuff, and just do what they say. And then if it don't work after a while and stuff like that, then complain. I want something else done, and stuff, because it's a lot of things out there. They got acupuncture and all these different things for you and stuff. So don't just stop at one, or they didn't even do nothing. They just gave me this, and now I'm hooked on pain pills and stuff. Let's find a solution. Just keep on. Don't give up on yourself. Yourself didn't give up on you, and everything. So then vitamin replacement. Making sure them potassium levels is on point. Making sure. Hello, Drina. Welcome on in. Thank you for coming on, my dear. We're talking about nerve joints and joint pain. Nerve, joint, and joint pain. I said all types of stuff. But anyway, we're talking about arthritis and all these good things. Carpal tunnel and the rheumatoid arthritis, gout, and all of that stuff. We hitting them all hard. And for anybody that missed some of it and stuff, it's okay and stuff. You can come back and watch the replay about 3 to 5 minutes after I get off the live and everything, which I'll be getting off in a few more minutes and everything, because I'm right at the good part, and I need to give this to you because this is a big concern for a lot of people and everything and stuff. So like I said, the anti-inflammatory, I'm back at the vitamin replacement, and then nerve blocks. That's when they give you them shots, them cortisone shots, which are steroid shots. But the only thing is, if you're diabetic, it make you more diabetical. It makes your blood sugars go up. But if you're not diabetic, it might go up temporarily while you getting those shots. And I got the shots. I'm a recipient of getting the shots in my feet and they wore off too quick, and stuff. And then they're like, you could get them up to 3 times a year or something like that. Sometimes they give you more and stuff like that. But just remember, it's doing something to that joint, and stuff. Every time that happens, it's doing something to it and stuff. So it's not a good thing. And then also, lifestyle changes like exercising, losing weight, dieting, and stuff like that. Those are all help, but exercising every day and everything. So then, joint treatments. That was nerve pain treatments, but joint pain treatments, anti-inflammatories like your Motrins, like your anything that might cause bleeding is usually one of the medicines and stuff, but Motrin is the number one. And they got this stuff called Toradol, which is IV joint pain stuff, and they can stab you and give you a shot, or they can put it in an IV if you're at the hospital and everything. So then for joint pain treatments, that's it. And then there's weight management. So yeah, you got to lose weight, and stuff. You got to slim on down a little bit and stuff. Not no major and not all at once and stuff, but it took time to build it up. It got to take time to build it back down, and stuff. And then you got I told you about the steroid injections, and stuff. Also, there's joint replacement in severe cases. So anybody that's up for that, that means your body was snitching. It was telling, and it was like, I'm going to kill you if you don't go get the surgery and stuff. That's what it'll do. It'll tear you up and terrorize you until you actually get the surgery. If y'all don't stop going and opening up that door, it's very special. I'm going to tell you now and stuff. And then exercise and stretching, that's another problem. And then movement is medicine. Movement is medicine when done correctly. Okay, so I'm coming to the end and stuff. I'm gonna do a little bit of myth versus facts, like untruth versus what the truth is and everything. But I just want to give you a couple quotes to live by on the nerve and joint pain and stuff. Pain is the body's whispering before it starts screaming. Pain is the body whispering to you before it starts screaming your name, help me. Numbness is not normal. It's a warning. Numbness is not normal. It's a warning. If your joints are talking, listen before they quit on you. And then you can't walk or you can't move, and you become crippled, literally. Your body keeps receipts. I said this one already before, but it still makes sense. Your body keeps receipts. Every ignored ache adds up. And then they got their proof. I told you this on Sunday at 3:30 p.m. on January the so-and-so. I told you. Okay, then I told you 3 days later, January the such and such. And so on and so forth. So your body keeps receipts. And then it knocked the crap out of you. Okay, and then pain doesn't lie. We just stop listening. Pain doesn't lie. Pain is not normal either. It doesn't lie, though. If it's pain, it's pain. If you're not listening to it and you just take something to mask it, any pain medicine, I don't care, Norco, Vicodin, Oxycontin, Percocet, Motrin, Tylenol, 500 milligrams, 2 or 3 of them or something like that. All of those, they are not cures for what's going on. Whatever's going on, if you don't pay attention to it, it's going to make you pay attention to it. Like you're not going to have a choice after a while and everything. So pain doesn't lie. We just stop listening. Okay. I ain't going to go to because I be sitting up in there all day and stuff. That doctor takes so long. Let them take a long time to pill out that day for them. You pill out the day for other things you're doing and stuff. So pill out the day for that and stuff. So then a myth or not truth is pain is just part of aging. No, it's not. In fact, chronic pain is not normal and should be evaluated by your doctor. Okay. Another myth or not the truth. Nerve pain is all in your head. Okay. So the fact is nerve damage is measurable and real. It's not fake and stuff. It's a problem. So another one, myth: rest fixes joint pain. If you just get some sleep and some rest, it'll go away. Has it, anybody? Mine didn't go away. It actually hurt it while I was asleep and stuff. So the fact is, too much rest worsens the stiffness because you're laying there and you're not moving at all because you sleep, and stuff. So you get stiff and you be stuck in that one spot. So when you get out of the bed, you got to throw yourself just about on the floor to get away, and stuff. So it's a problem and everything. So then, myth: if it's not swollen, it's not serious. That's a lie and stuff. It says nerve pain often has no visible signs. So sometimes it doesn't even have that sign. So I'm finishing off and stuff. Let me see what my cousin said. She said, "Yeah, cuz I know you do your homework because my doctor said everything you said tonight. I thank you for putting in the work, then giving it to us. You're appreciated." I appreciate you. Thank you so much. Wow. I appreciate that. Yes. And Drina said, it's so true. That's right and stuff. This is what's happening to us and stuff. But it's not fair that we don't know exactly what we're doing to ourselves. Because even as a nurse, I'm going to treat a symptom. My patient, complain, I'm hurting, and stuff like that. I'm going to give them what they have for pain medicine as needed and stuff like that. I'm not going to go in and try to find out in your medical history, did anybody else have? No, I don't. I don't even have time to care, and you know what I'm saying? But guess who else don't have time to care? The doctor that's assigned to you. You see what I'm saying? They want, sometimes they do want an easy route. And all you have to do is be silent and you get the easiest route. Then you get discharged and you jacked up when you come home, and stuff. Something go wrong, this go wrong. And then you don't even know how to report it. I just came from the hospital. I don't want to go back. Well, yeah, you can go back in a body bag, and so I'm just saying, so you're going to have to start telling on it. Find out. Even me. That's why I do these things and stuff, because it makes me evaluate me. How much pain am I gonna take, and stuff? How much am I gonna go through? Yeah, Tony said, yep. That's right. So as I ended and stuff, it's these are some good things, and I need you guys to catch on to this if you don't get nothing else out of it, and you can watch the replay and everything and stuff. When to seek medical care. Seek help if pain is worsening. It's getting more and more. So you go from they say on 0 to 10, 10 being the most horrible pain in the world, you at a 9, and then you at a 15. We only said 0 to 10, so if you had a 15, you already off the scale now and stuff. So it's worse, and everything. Then it affects your sleep or daily life. I can't go to work because I can't even move. I feel like I'm crippled, and stuff. I can't sleep because it just hurt me. Every time I turn over on this side, I turn over on this side, and it hurts, and stuff. That's a real thing. And then it comes with weakness. Like you start losing a feeling in your legs and you just turn the rubber and you just drop, that's a problem. It causes numbness or loss of control. Or you hurting so bad that you pee on yourself or something like that, or worse, and stuff. Or it appears suddenly and very severe. Auntie Rena said, Godfather say he really enjoys. Bless his heart. You tell him thank you, and I hope that he gets whatever, because that was my number one champ and stuff. Back in the days when I was doing medical corner and stuff like that. Is he was really encouraging me. Come on, we're gonna talk about so and so next week. And we're going to talk about this and, and stuff like that. And he really enjoyed it then. And I thank goodness I didn't leveled up, though. I definitely leveled up. So I hope he's proud of me and stuff. But yes, I'm coming to my end now and everything. And that's the take home message and conclusion. So take home message. Nerve and joint pain are not just aches. Okay. They are messages, alerts that something deeper needs attention, that something needs to be paid attention to. before you don't get no control over it and it take you down on its own. Okay. Ignoring pain doesn't make you strong. Listening early keeps you mobile, which keeps you moving, independent, and whole, and everything. So listening early, tell on it early, and then you don't have to get so much work done. If you tell on it late, that's when, hey, but at least you told on it. So I say tell on it, period. I don't care if it's been going on or it's just now coming and stuff. Tell on it. Tell, tell, tell. Okay. So then your body is a snitch. Believe it, respond to it, and protect it. Protect your body. Believe it when it's telling on it and stuff. Believe it when it's snitching, because that's a real big thing. Rena said, Auntie Rena said, he said, amen. He is very proud of you. Thank you. Bless your heart and stuff. I appreciate you guys. And like I said, unless other circumstances come, like life be lifing on me too and everything, I come on every Tuesday with a new cutting edge Tuesday at 7 p.m. Pacific Standard Time. And I come on with things that I weigh the audience and I weigh people that, talk to me or message me and stuff so that I'm paying attention to what they're talking about. Like I would have never known that menopause doesn't just affect women and they hot flashes and stuff, that men get affected and they get ready for menopause after the age of 30. So 31, their testosterone goes down and stuff. 32, it goes down a little bit more. 33, it goes down a little bit more. So even at that young age and stuff, when they still, young and tender, they still can get it. They still can have problems, and everything. And that's where all this stuff comes in, and you wonder why everybody around you, all of a sudden, everybody big, and stuff, everybody fat and stuff. Yeah, well, yeah, first it's growing up. Remember, your body is this amazing machine that does all these different things and has all these working parts. And, like I will never run out of material. It's your body, and stuff. I will never be able to run out of material because there's so many things to talk about. There's your mental health, and that's talking about different things and stuff, and different drugs we put in our body and stuff like that, and substance use disorders and stuff like that. Those are all a part of your mental health. Then you got physical health, that's your arthritis and your joint problems and all of that type of stuff. You got skin problems, you got psoriasis, eczema, rashes, different things like that and stuff. You got all these different things. There's also your GI system, which is gastrointestinal system. That's your boo-boo, that's your eating, that there's eating disorders, there's all these different things. But eating disorders is not just eating, it's actually a mental health problem, and stuff, or mental illness, and stuff like that. So all of those mixed together and stuff, so it's just more and more and more. So it's like you'll never run out of information and everything. So I'm going to go ahead and let you guys go. I've been on for an hour and about 20 something minutes and everything and stuff. I do appreciate everybody that came on. If you missed something, do not fret. The only thing that you might have missed is interacting with me, live and everything and stuff, especially if you want to tell your story and stuff. But if you didn't get a chance this time, come back next week and tell your story and stuff, because I always give you full reign to just come on and tell your side of the story and what happened to you and how your body kept receipts and how your body snitched on you, and stuff, because that's what I'm talking about, the human body and stuff. So when we're doing this, it makes so much sense, and everything. But yes, we got to find out what's happening with us. We got to find out, what we doing and stuff. We don't need to get to the end and be like, there's nothing more they can do for you. I don't want to hear that and stuff. My mother just survived cancer. And last Tuesday, she, so 7 days ago, she graduated from radiation and stuff. This woman then went through 7 cycles of the strongest dragger type killer chemotherapy they got out there for her particular diagnosis of cancer and stuff. Then she had to go through a 6.5 hour surgery. I don't even know if they're supposed to last that long, but I had already cried and start planning the funeral. It was so bad, and stuff, because guess what? That's my mama, and she's not a patient. But I'm saying all of this to say that she went through all of that. Then we had to heal. They cut her from her breast all the way down to her belly button, and opened it up and took a whole bunch of things out. I was like, put some back in, like, what's wrong with y'all, and stuff. But anyway, she healed from that, and everything. She's still healing, but I'm just saying all of that. And then she went through 27 visits of radiation and stuff. So could you imagine all of that? And guess God gets all the glory for it, but guess why she did it? Because she trusted that I was going to take care of her. So she believed me. That's a big deal, and stuff. So when you're looking at me and stuff, forget all the glitz and glamour and the sparkles and all of that stuff. Look at, I'm a real nurse. This year is 22 years. I had to have learned something by the end. I had to have stepped in something. I had to have seen stuff that I can't unsee for the rest of my life. But at the same time, she believed it enough to go ahead and tell on herself. Oh, all she gonna do is, she didn't say all you gonna do is give me some Pepto-Bismol. She actually said, I'm gonna squabble up, Charlene, in those words. And so Kendrick Lamar, no, I'm just playing. But I'm saying all that to say, she said she's gonna stand up to the plate. And she's around, she's getting in there and stuff. She got a lot of things going on and stuff like that. And it's a lot of recovery still left to do. But the whole point is she rung the alarm. She rung that bell, ding-a-ling-a-ling, or whatever you go to, not ding-a-ling-a-ling. That sound funny. Ring, ring, ring. And stuff. But I'm saying all of that to say that, wow, God don't make no mistakes. He don't play about us and stuff. As long as you love him, I'm telling you, and stuff. And like I said, the God of your understanding, if you don't believe in God that I do, I'm a believer. I just happen to be a nurse that's a believer and stuff. But everybody to each his own. But I'ma still shout his name out. He get all the credit, because he didn't have to wake up the doctors. He didn't have to wake the patient up, and he didn't have to wake me up to see everything and stuff. So at the end of the day, it is what it is. So let me read these comments and then we'll come on off and stuff. So we got Drina said amen. And Cousin Tony said, thank you, cuz I love and appreciate you so very much for the support and love you give us. You rock. Bless your heart. I love that. Y'all see that? Everybody see that? I'll put it up on the screen. That is wonderful. I appreciate you and love you too, cousin. And Drina said, tell her I love her. She said, tell my mommy Rosie, Mama Rosie, she love her and stuff. Or I call her Rosie Granny Allen on here and stuff. But yes, I sure will. She's probably looking at it right now, but I'll still make sure I tell her and stuff. And just bless everybody's heart. I'm glad you guys got in. Whoever got in, it might have been just for you, just to understand your body and stuff. And that's okay. And even if it wasn't just for you and your body and stuff, now you can help somebody else that's suffering with these same symptoms. So go back and watch that replay. It's on Facebook under Charlene Nurse Allen and stuff on Facebook, and it's public, so you can just get right on and stuff. But it's also streaming from YouTube, and it's under Medical Talk in Layman's Terms with Nurse Charlene. And of course, I'm Nurse Charlene and stuff. And this is the real deal. Because remember, life is not just lifing on you, it's lifing on me too. And I got to stand up. What we going to do, stand up or fail? And if you fail and fall, you better learn how to get back up. As long as you awake, God said, I'm giving her one more chance. I'm giving him one more chance. But it's when you don't get up and you just feel sorry for yourself. Just let me go. I'm just ready to die. What about your family that love you and stuff? So if y'all understand that, y'all understand me and stuff. I sent my heart out to everybody. Y'all take care. Woo! Another one down in the books. It is nerves and joint pain. I hope you got something from it. Take care, everybody.